Hello, I'm Armin Budish. Welcome to Golden Opportunities.
Today, is your posture not so perfect? We'll set you straight with our advice. Then we put fall's favorite fruit to the test and compare apples to apples to find out which are best for biting. Do you have a long-term plan for covering the costs of long-term care? Plus, we'll list the ingredients for preparing a way to mix friends and food. And we'll reveal a little-known technique to increase your retirement income.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. When we're feeling fine, it's easy to ignore our health. But when something goes wrong with it, then we're anxious to follow doctor's orders. Is there another way to approach wellness and our physicians? Dr. Noel Abood is here to help us redefine our relationship with our well-being and those who treat us. Dr. Abood is with the Soul and Spine and Wellness Center. Thanks for joining us, Doctor. Does doctor know best?
In general, but times are different. I mean, you have to admit, years ago, whatever the doctor said went. But I think times are changing, and I think doctors as well as patients are more open to dialoguing more about their condition and about their future care.
Is it up to us, the patient, to open up that dialogue?
In each case is different, but I would say overall that is an accurate answer. It's up to us to be able to go in with an agenda and make sure that we better understand our health.
Now, many of us develop a financial plan. We talk about that on the show all the time. What about a wellness plan or a healthcare plan?
I think it makes sense. I think in the past it'd just be the doctor would say, do this, and then we would just blindly follow the orders. But with the internet and all this new information, why not go in and I think it's best that if a doctor has a dialogue with his patients where he can say, where are you at right now? Where do you want to be? And what are your goals? For one patient, he may want to continue running marathons into his 60s and 70s. Another says, I just want to be able to play with my grandchildren. And so maybe the doctor and the patient together can come up with a series of a health plan for them.
What kind of things would go into this health plan?
I think it's important when you set the goals is to find out, we need to look at, as we've talked about a lot on the show, is diet, exercise. What kind of medicines? Maybe have you had a discussion with your doctor in the past 10 years here's the medicines I'm on. Are these still adequate? Are there any improper interactions between these medicines? So reviewing that with him, reviewing your daily habits, your smoking habits, your mental health as well.
One of the biggest problems we deal with in life and on the show is back pain. Tell us about how you would go about or what you would put into a health plan for someone with back pain.
And I think we try and approach it on a more global aspect. So if you have back pain, it may be because you have a poor sleeping situation, or maybe you're wearing the wrong shoes, or maybe you're not getting enough exercise or drinking enough water. So what we like to do during our initial consultation is determine what brought you to this point of back pain and what are some options that we can do, maybe not even in our office, that you can go home. Maybe you don't need treatment at all. Maybe it's just a matter of tweaking a few lifestyle changes, and it can make all the difference in your health.
And then, you mentioned the range of activity. Just somebody might want to get rid of their back pain so they can run another marathon, somebody else just so they can get to the mailbox. I assume that the goal makes a difference in the plan in terms of what you're going to do to help solve the problems?
Right, and in some patients I say, I believe I can get you to run a marathon, but it's going to involve X, Y, and Z, and they're unwilling to do that. So they say, maybe I just want to be able to run 10 Ks, and so, okay, let's formulate a plan from there. So again, each case is individual, and we try and do that with each patient. We try and look at the bigger picture in their health.
And so just give us an example. Somebody comes in and says, I've got this back pain, I've had it for the last number of years, it's getting worse, lower back, whatever, and I can't even, I have trouble walking around the house now. Mm-hmm. What would you tell them?
Well, we discuss, what did you have? Did you have surgery? What is your thoughts on surgery? If the patient says absolutely no, then we say, let's look at this. There's some natural alternatives that we can do. Then we do an evaluation. I sit down and I'd like to have the spouse or the loved one with them during that consultation so that we can formulate this plan together. And a lot of times the spouse will fill me in on things that the patient might not necessarily.
And you have a number of specific treatments that you do, including the lumbar decompression that you've talked about, which I understand has helped a lot of people.
It has, and it's a natural alternative to surgery. It's a natural alternative to long-term medications or pain management. It's a technique that brings blood into the disc through a specialized table. And once the blood gets in there, it brings oxygen, and oxygen is like a healer. It can allow the disc to repair itself.
Thank you very much, Doctor. Appreciate it, as
Thanks.
always. You invest your money, why not invest in your own well-being? Follow Dr. Boud's suggestions and create a health care plan for yourself. The dividends are priceless. To find out more, give Dr. Boud a call. His number's up next.
Learn more by calling the Solon Spine and Wellness Center at 440-248-5070 or visit their website, www.solonbackpain.com. Next, picking the best apples for biting or baking. But first, before Virginia McMath and Frederick Osterlitz stepped into their starring roles, their unstylish names were changed because they were as awkward as two left feet. So who did this dancing duo become? We'll waltz back with the answer when we return.
Welcome to Breckenridge Village, a continuing care retirement community conveniently located in historic Willoughby, Ohio. Whether it's a luxury apartment, a spacious ranch home, or newly built brownstones, it's all here with the added security of knowing more care is available when you need it. Breckenridge Village offers an exciting and upbeat lifestyle, and the food is fabulous, and our staff makes you their #1 priority. Learn more about Breckenridge Village and come see our new Veal Wellness and Aquatic Center.
Today, we know Virginia McMath and Frederick Osterlitz as the suave couple, Ginger Rogers and Fred Astaire, who waltzed, tapped, and jazz danced their way into the hearts of fans everywhere.
This next segment, I think you're going to find it, very appealing. Now, fall means apple picking time, and to get to the core of the perennial question, which apples are best for biting and baking, we've invited Sally Beckwith to our kitchen. Sally's with Beckwith Orchards in Kent, and she's harvested a bushel of information for us. Thanks for joining us today.
Thank you for having me.
All right, so is fall really the only apple picking time?
Well, a few varieties actually ripen in July, but we're just getting into the real heart of apple picking right now.
Okay, what's ripe now?
Well, we're just starting to pick an apple called Melrose, which is one of my favorites.
Did you bring one of those?
Yes, those are up front here.
Okay,
this is
the
actually
green ones?
Yes, they're actually a little bit. They'll color up a little bit more, but that's actually the state apple of Ohio, which a lot of people don't realize.
Oh, well, I knew that, of
You
course.
did know that.
Oh, of
Okay,
course.
great. Well, it is a cross between the Jonathan and the Red Delicious, so it's a very crisp apple, and it also stores very well. So for people that are looking for an apple that they can eat throughout the winter, that's a great selection.
What else do we have here?
Empire.
What's next over here? What are these?
We also have, I brought some Empire today. That's a cross between the Macintosh and the Red Delicious. So it starts out as a fairly crisp tart apple, but it starts to mellow a little bit. So if people don't like a real firm or they have a hard time chewing a hard apple, that would be a good selection.
All right.
Next, I brought some Galas.
These here?
Yes, and this is a wonderful apple because it's a nice size, very sweet, rates excellent for eating and baking, and it's a perfect selection if people have children or grandchildren over, because we feel very strongly you need to get a good tasting apple into their hands, and that's a great option for school lunches. And
what about this green thing?
the green thing, those are Mutsu. It's a rather large apple, also rates excellent for eating, baking, just about anything you'd like to do with an apple.
All right, now I see some things here that aren't apples, but I think came from apples. First of all, you got apple cider?
Absolutely. Our apple cider is, we follow the Cornell University program, which is to pasteurize your cider, but do not add any additive or preservative. So we usually blend at least 3 different varieties, and Yep. I think it's
What
quite
kind of
good right
apples
now.
in here?
This would be a blend of at least 3 of our current varieties right now. We're probably having lots of Melrose, some Gala, some Empire, so we get some of that sweet and tart all blended together.
Right, now as much as I love apples, I love these things much better.
Okay.
Tell us what those are and what did you use to make those?
Well, every morning we do bake pies fresh in the bakery, and the apple selection varies a little bit throughout the season, but Northern Spy is the apple of our choice for our pies. As my grandfather used to say, a pie is not a pie unless it's made with Northern Spy. So, very popular pie apple, and we have a caramel apple walnut here, and then our basic full crust apple pie as well.
This is the regular old apple
Yes,
pie
it
right here.
is.
I'm going to reach over and take this. Am I allowed to eat this?
Absolutely.
Well, it's a good
That's
thing
what
you
we
said
bought
that
for
because
you.
I was going to do it anyhow. Now, what kind of apples in this?
That's the Northern Spy in the pies. And
Good.
I think so too. And it doesn't hurt every morning to be baking these and have that wonderful aroma throughout the building and parking lots, so that helps quite a bit.
All right, and Beckwith Orchards, you have entertainment out there and other
Absolutely,
things
and
people can
it's
come
a
on out and
great,
have fun?
absolutely great place to come spend a weekend. We have free musical entertainment on Saturdays and Sundays. Everything from country western to folk and bluegrass music. Some
Sounds
Scottish
great.
bagpipes performing this fall. So all kinds of fun activities coming
Well,
up.
thank you very much.
You're welcome.
And
Thanks for having
I'm going
us.
to try to close this with my mouth full. So, now that we've compared apples to apples, it's hard to pick a winner. They're all delicious. To take a peek at these many tasty choices, take a trip to Beckwith Orchards. The information's coming up next, and I'm going to eat.
Find out more by calling Beckwith Orchards at 330-673-6433 or click to www.beckwithorchards.com. Next, adding up ways to prepare for long-term care. Looking for places to go, things to do? Welcome to our community calendar. Get ready to put one foot in front of the other for the 7th Annual Cleveland Senior Walk. Step out Thursday, September 29th from Voinovich Park at the East 9th Street Pier, and when you lace up your walking shoes, you'll receive a free t-shirt. Registration and health screening start at 8:45 a.m. and the walk begins at 10 a.m. To find out more, march to the phone and call the Cleveland Department of Aging at 216-664-2833.
Putting your hard-earned money aside for the possibility of paying for a nursing home can cause a bad case of financial paralysis. It's hard to do. But if you succumb to inaction and you end up needing long-term care, probably you'll need and experience another ailment, and that's called sticker shock. Jim Lineweaver's here to nurse us through these conditions with unique ways to prepare for long-term care. Jim's a certified financial planner with the Lineweaver Financial Group. Thanks for joining us, Jim.
My pleasure.
All right, so gas, food, clothes, everything, the price of everything's going up. Does that include long-term care?
It does. Care is extremely expensive these days, and it's going up every year. Matter of fact, MetLife came out with a study recently that said in Ohio, the average semi-private room is going to run you about $75,000 a year, and the average private room is all the way up to about $118,000 a year.
Wow. So what have people been doing to prepare for long-term care costs?
Well, some people can just decide to self-insure, and that's okay if you have the resources and you understand the full ramifications. Other people have had some sticker shock.
Self-insure means you pay out of your pocket.
You're going to pay out your own pocket,
Okay.
not get any insurance, not pass off the bills to anybody else.
Right.
Then you could also look at different types of insurances, and if you look at the traditional long-term care, you pay a premium, and if you never use it, you lose it. So therein lies the problem. But it
There's
can
some
provide
new
very
options,
good coverage.
though. There's new options.
There definitely is.
Tell us.
Yeah, what ends up happening is the insurance companies have figured out a way to try to make sure that you have no lost opportunity costs. So in other words, you're never throwing that money out the window. And what they did is they wrapped this around a life insurance. So you take a life insurance policy and you can get like a convalescent care or these riders that you can put on there for any type of nursing home or home health care or things along that nature.
I think it'd be easiest if you could walk us through an example to show us how this works and
Yeah, we'd be happy to.
Yeah, great.
We actually have we looked at a female who is 65, and we looked at her taking a lump sum of $50,000, a one-time payment, and putting it into this life insurance with the long-term care rider. And what happens is she can take out the money whenever she likes, so she can access that $50,000, but she also, in the event of her death, has a $71,000 income tax-free and estate tax-free life insurance policy coming in.
But what if she needs long-term care?
Well, this is a great part of it. What ends up happening is she needs nursing home or some type of long-term care. She can get $2,900 a month out of this policy for a total of 6 years or $214,000 worth of coverage. And no matter what happens, even if she uses that long-term care, she can still at least have a surviving death benefit of about $7,100.
Wow. So if you already have life insurance, can you transform it into this new kind of policy?
You might be able to, but a lot of times you have to look at taking that either to another company or to a new policy, because they wrote that policy years ago and they didn't have these type of riders, so a lot of times you need to look at other coverage. But if you have cash value in there, a lot of times you can roll that or 1035 exchange that to another company, not pay any taxes on it, and get one that has this rider and better protect you and your family.
Does the government provide any help in getting this insurance?
This is one good thing that came out, especially in the state of Ohio. They came out with a partners program years ago. And what that does is it allows people that decide to get this type of long-term care or the traditional kind, doesn't matter which, whatever they get as a total long-term care benefit, they can protect that equal amount from the Medicaid spend down rules.
Oh, good.
So the government's clearly stating they don't want to pay for this stuff and they're giving you some benefits so that you can take care of it yourself.
Great. Everyone should have long-term care or no?
Well, it really depends on their individual situation, but everybody should address long-term care for their own financial situation and at least check it off. They got it off their bucket list and address it one way or another.
Great information. Thanks, Jim.
Appreciate it.
Use the short term to think about the long term and how you might afford the care that you may need. With these new options, your money won't go to waste. Even if you never need a nursing home, your money won't go to waste. To find out more, give Jim a call. His number's up next.
For more information, call the Lineweaver Financial Group at 1-888-313-4009 or log on to www.lineweaver.net. Next, table for one. It's time to get up and go. An exercise minute on Golden Opportunities.
Hello, I'm Mike Carbon from Breakout Fitness, and today we are going to work the quads in the front of our legs by doing a single leg press with our exercise band. This exercise is going to help us get up and down the stairs a little bit easier. All right, you ready to go? You got your band? Excellent. We're going to start with one leg bent at a 90-degree angle, our opposite leg out in front of us. Take the middle part of the band and place it right around your foot. Bring your fist to your waist. Great. Now remember, we never want to lock the knee, so always keep a slight bend. Bring your knee to your chest and extend all the way to the ground. Knee to chest and heel to ground. Nice and slow. Good job, Armand. Push it out there, buddy.
Enough to the ground?
You can get it. Push it all the way out.
I don't know. It doesn't
All right,
go.
opposite leg now.
It's
knee to
easier to
chest.
come up.
Heel to ground. Try to breathe. Big deep breaths. 12 to 15 repetitions, 2 to 3 times a week, everybody. Now's your turn to get up and go.
For your copy of the exercise booklet, please send $1 for postage to Golden Opportunities, 23240 Chagrin Boulevard, Suite 450, Beechwood, Ohio, 44122.
Today's young families are hearing how important it is for everyone to sit down together for dinner, and what a positive impact this time together makes on the children, for example. Now we're learning that the same rule applies to eating with our elders. Roberta Woodard is with Home Instead Senior Care, and she's here to explain why so many seniors are craving companionship and how we can carve out time to make it happen. Thanks for joining us today.
Thanks for having me.
All right, so you have a survey results that you're going to tell us about, craving companionship, that dishes out disturbing facts on seniors' nutrition. Tell us about it.
We do. Our network had found that the U.S. Census Bureau actually said that 6.7 million seniors over the age of 75 or older actually live alone, and within that statistical population, nearly 40% of them are at risk for low or bad nutrition. What that does, Armand, is it allows them to particularly have a difficult chance from coming back from catastrophic illness or a fall, and it adds to just general not well-being overall.
And there are other factors, too, that affect the nutritional habits of these folks?
Oh, sure. It can lead to loneliness and isolation. It can lead to not being able to get out and shop. There's just all kinds of general things that poor nutrition leads. Their healthcare costs go up. It's just general poor nutrition in seniors can make them weak. It's not a good situation, period.
One thing that I found very interesting, that there's a finding in your survey that about how eating alone can affect the way older people eat.
It's not really new to us. It's nice to have the research behind it. For years, we have sent our caregivers in to be companions to a senior, and what we've always known is they eat better when they've got somebody with them. And what it boils down to really is no one likes to eat alone, and our survey actually found that out. So it's helpful that the actual results were 75% of seniors don't want to be alone when they eat, and they eat better, they're happier, and they're more satisfied if they have someone sitting there with them.
So what can we do?
Oh, the answer is very simple. Have them over for dinner or take dinner to them. It seems that simple, but truthfully, 96% of seniors believe that their happiest memories were when they had dinner with their kids or their grandkids. So when you start doing the math and you think how simple it is, have them over for dinner.
That's not always possible.
No,
I mean, it's nice, it's
not.
wonderful, but I mean, what else can we do?
Well, you can rely on neighbors or friends. You can, for instance, a neat program that we do, in Medina County, there's a local grocery store that you can actually shop online and know what they're doing. You can use churches, the Area Agency on Aging, Meals on Wheels. There are all kinds of things. You can hire Home Instead to come in and be a companion. Local neighbors, there are all kinds of things you can do.
Churches, synagogues, others
Meals
provide
on Wheels, yes.
congregate meals. There's things you can do.
Absolutely.
Resources in the community.
Absolutely.
Thank you so much. It
It's my
really is
pleasure.
important. Appreciate it. You just heard the recipe for helping seniors eat healthy. When you do your meal planning, plan on including mom and dad in the meal, at least now and then. After you've digested our facts, if you want more ideas and information, community resources, check out the website that's coming up next. My thanks to Roberta for joining us at our kitchen table. I only regret that I didn't offer her a piece of pie. We'll be right back.
To learn more about the Craving Companionship Program, call Home Instead Senior Care at 866-996-1087 or visit www.mealsandcompanionship.com. Next, if you served the public, we're here to serve you.
We're Gateway Title, keeping life simple. We can make it simple. We've got everything you need. See how easy selling your home can be. We're Gateway Title. We're keeping life simple.
Actually, I only gave her an apple, and I'm keeping the pie. Did you miss a phone number or website? Then here's your second chance, because we're going to list all of that information again. Then I'll be back to tell you about how Social Security benefits are being slashed for some workers. I just can't get no respect. If Rodney Dangerfield had copyrighted that famous phrase, he'd be reaping heaps of royalties from public servants here in Ohio. Yes, it's been a tough year for teachers, police officers, firefighters, nurses, and other public employees. Today, Mike Solomon's here to respectfully offer public servants a little-known tip about how to preserve more of their money in retirement. Thanks for joining us, Mike.
You're welcome.
What's the windfall elimination rule?
Well, I mean, a lot of people work both and have overtime in the private sector and for the government. And under the windfall rule, when they get out, and they paid into the retirement plans over those periods of time, and when they retire under this windfall recovery elimination rule, Social Security will offset part of the benefit they receive from the government. So it reduces their Social Security benefit.
How much do you lose?
Well, it could be a significant reduction in their Social Security benefit. And what you can do is go on the website, www.ssa.gov, and they have a calculator there, and you can figure out exactly how much of your retirement you're going to lose.
Is there any way, since you've paid into both your pension and your Social Security, or is there any way to protect both of those in retirement?
Yes, actually, there's a little-known rule that can be really valuable for people. If you've worked 30 or more years and you've received substantial earnings over those years in the private industry, then you will be able to still get your Social Security without having it reduced by the government pension. So what you need to do is look, on your Social Security sheet that you get that annually. It says
Right.
what your benefits are. See if you've hit the 30-year mark. If you haven't, then you need to do some planning.
How much do you have to earn in the private sector towards that 30 years?
The numbers are approximately $20,000
Now.
So
and then it would have been less in prior years.
that's right, way back then. So if you can hit that target, and for some people they can do that on part-time, some may need to work full-time, but if you're close to 30 years, you should make a determined effort to do that because there's a big benefit that you can get out of it.
So right now, if you've got 28 years in, for example, maybe a couple years of even part-time work might be enough to get you protect your full Social Security, which would be a lot of money.
That's right, over the many, many years. That's correct.
Well, thank you, Mike. Great advice for people who could use the help right now.
I'm glad to be here.
Efforts have been made by senior advocates for years to get Congress to eliminate the windfall elimination rule. It's simply not fair. We've lobbied right here on Golden Opportunities, but so far those efforts have not been successful. Follow Mike's advice and take a look at the number of years you've worked in a private job under Social Security. If you're short of 30 years, work a little longer if you can, even part-time. Get to 30, you could save a lot of money.
Call Budish, Solomon, Steiner, and Peck at 1-888-236-5173 for more information, or log on to www.budishandsolomon.com.
Thanks for joining us. Next week, You're Never Too Old to Learn. We'll open the book on classes for seniors that earn an A+. A simple wound can wind up being worrisome. We'll wrap up treatment tips. Our lips are not sealed. We'll share secrets to a winning smile. And extra, read all about it. We'll meet the journalist who was a front page girl. Until then, please remember to make the most of your golden opportunities.
Would you like to join our kitchen conversation? All you have to do is call toll-free 1-877-765-1543 and leave us your question, name, and phone number. Or log on to www.golden.tv for all the latest information and show updates.
Golden Opportunities is paid for by Elder Productions.